Ginger has been used for thousands of years in kitchens around the world. And you and I, probably at different stages in our life, have enjoyed ginger tea or ginger biscuits, and possibly even as a grandmother's treatment for various conditions such as cough or some digestive problem. However, did you know that modern research is showing that ginger is very useful for either prevention or management of diabetes? In this video, I'm going to tell you 5 different ways ginger is useful for prevention or management of diabetes. Two of those ways will be useful for prevention, and all the five ways ginger acts will be useful for management or maintenance or control of diabetes. Towards the end of the video, I'll also tell you how should you consume ginger, how much you should consume and how should you consume, or what are the various ways of consuming ginger. Now, I'm not going to rely on some old science, though that is also useful and that is also proven for thousands of years. I will use the research in last 20 years or so, whatever has been published in peer-reviewed medical journals about the research of either ginger or the active ingredients of it. So whatever I'm talking about is the new research about diabetes. Ready? Let's roll. The first way ginger helps is by reducing sugar digestion in the intestine. Ginger blocks certain enzymes that are useful for metabolizing sugar, that is carbohydrates, and lipids in the intestine. So it's as good as not eating those foods or eating less of them. And since eating less carbohydrates is a good way to prevent diabetes as well as keep your blood sugar in check in diabetes, this feature of ginger helps in preventing diabetes as well as getting your blood sugar in check if you are diabetic already. The second way ginger helps is by increasing insulin secretion. Now, you must be knowing that once you have a high carbohydrate meal or so, you kind of get a nice feel good feeling. Some people get a good snooze. What happens is there is a neurotransmitter called serotonin, and its levels go up after a good meal, and that's we call it a feel good hormone. And serotonin essentially increases the insulin secretion after a high carb meal. Now, the way this happens is our body has some things called serotonin receptors, things to which serotonin goes and attaches. And when serotonin goes and attaches there, serotonin effectively becomes active. And that is known to increase the insulin secretion. Now, in diabetic patients, and we don't know why, but diabetic patients, these serotonin receptors are damaged or dysfunctional or inefficient. And so, even if serotonin is secreted, the serotonin doesn't go and attach so well to these receptors. And so, the insulin secretion is less, and therefore, blood sugar goes high. And ginger interacts with this serotonin receptors and kind of re-establishes their action and thereby increases insulin secretion. Now, this obviously won't be very useful for preventing diabetes because a person who is not diabetic doesn't have this problem. However, somebody who is already diabetic, this feature is very useful in getting the blood sugar in control. The third way ginger helps is by reducing insulin resistance. Now, you must be knowing that when you develop diabetes, essentially your body goes into something called insulin resistance. Your body in diabetes typically becomes resistant to insulin, and thereby the blood glucose doesn't enter your cells so easily so as to generate energy. Ginger is known to reduce insulin resistance in type 2 diabetics. Now, we still don't know if it also reduces insulin resistance in people who are developing diabetes, about to develop diabetes. But insulin resistance is insulin resistance, so it's not going to be logically different in people who already have diabetes and people who are on the verge of developing diabetes. So you can either consider this is a trait or feature useful for treating diabetes, or you can say that it is useful for treating as well as preventing diabetes. It's up to you. It's definitely good for treating diabetes. The fourth way ginger helps is by mimicking the action of insulin. Now, this is very interesting. You need insulin to get blood glucose into the cells. Cell membranes allow blood glucose to enter inside the cell if insulin is present in the blood. Now, in diabetes, insulin is itself very scarce. Ginger indirectly has an action whereby this same blood glucose entering into the cell action is precipitated or activated or encouraged or enhanced even without the presence of insulin. And this is a way it will be useful for managing diabetes. Preventing diabetes, obviously, this will be of no use because people who don't have diabetes already have enough level of insulin or already have enough insulin in their body. The fifth and very interesting way ginger helps is by preventing or delaying the development of diabetes induced medical complications. Now, years of high blood sugar, such as what happens in diabetes, causes many of our internal organs to get damaged. Organs such as liver or kidneys or eyes or even the nervous system. At least half the people with diabetes develop fat accumulation inside their liver, causing a condition called fatty liver, or medical term for that is non-alcoholic fatty liver disease. Many diabetic people also develop kidney damage, which is called diabetic nephropathy, eye damage, which is called diabetic retinopathy, and the nervous system damage, which is called diabetic neuropathy. Ginger is found to either prevent or delay the onset of these complications. So that's a phenomenal feature. That's an excellent way ginger helps in diabetes, because it's not very easy to prevent these damages if your blood sugar is not in control. And ginger, by doing that, helps in diabetes, but it's not so useful for prevention part because you don't have those complications. So there's no question of getting those complications in the preventive stage. By the way, prolonged presence of high blood glucose also causes heart disorders. It has been found that 10 to 15 years of diabetes and people develop heart disease. And ginger also helps in preventing these heart problems that are caused due to diabetes. So that's also an additional bonus due to ginger. And these are wonderful benefits. But the big question is, does ginger actually reduce your blood sugar? Because unless it reduces that blood glucose, all these other benefits are just theoretical. I mean, it's nice to have them, but if it doesn't help in reducing blood glucose, what's the use, right? And that's where we have great news. Some trials have found that giving 1.5 to 3 grams of dried ginger powder, not actual ginger, but dried ginger powder, for 3 months lowers the blood glucose levels in type 2 diabetes. Now, I personally think that's too high a level. You should not go and take 1.5 to 3 grams of dried ginger powder, because that's almost equal to 6 to 12 grams of fresh ginger. And I think anything above 4 grams of fresh ginger is too high on a daily basis, but we'll talk about it later. Just keep in mind that it has been found to be helpful. Yeah, it's not just a theory, it's practically also useful. Now, ginger is not just useful for diabetes. It has been found to be useful in many other health conditions. And I'm not talking about old research. I'm talking about research in last 20 years where they have found that ginger is useful for many health conditions. I'll mention them. First of all, ginger has a lot of antioxidant compounds, and so it has a lot of anti-inflammatory properties. Now, the good part is ginger has no gastrointestinal side effects, right? In medicine, we have painkillers, some things called non-steroidal anti-inflammatory or NSAID medicines. While they are good, they also have side effects. Some of the side effects are gastrointestinal, stomach pain or all sorts of things. However, ginger doesn't have any gastrointestinal side effects, though it has anti-inflammatory properties. So it can be used for reducing pain and swelling in many conditions, conditions such as joint pain in arthritis or muscle pain. Okay. Ginger is also useful in bronchitis, acidity, or what we call heartburn. It has been found to be useful for upper respiratory tract infections. I mean, I mentioned that our grandmothers' remedies, where people were giving ginger for cough and stuff like that. Ginger is useful for menstrual pain, and of course, the classical use is digestive problem. It is excellent as a digestive product. Now think about it, you can take ginger for diabetes, but it doesn't know that it has been taken for diabetes. It doesn't know that it has to go and help you with diabetes. It's going to help you with all these other conditions. So it's an excellent product to have, excellent ingredient to have, and you're not trying something unusual, you're not trying some unknown product. It has been part of your food chain for your life, and for thousands of years in mankind's history, it has been used. So we all know its good part, its side effects, if there is any risk profile, it is already known. It has been time tested, as we say. But how much ginger you should take for these benefits? You should take 4 grams of fresh ginger a day to get those benefits that I spoke about. This should be equal to about 1 teaspoon of grated ginger. Now, if you want to take it as a dried ginger powder, keep in mind that ginger is roughly 75-80% water. So if you remove that, you get dried ginger. And so 4 grams of fresh ginger is roughly equal to 1 gram of dried ginger powder. So you can take 1 gram of dried ginger powder also. Now the problem is, if you try to take more than 4 grams of fresh ginger or more than 1 gram of dried ginger powder, you run a risk of developing acidity or heartburn. And that's why I was not very comfortable at telling you to take 1.5 to 3 grams of dried ginger powder, which has been found to be useful for lowering blood glucose in those trials that were conducted. Now it doesn't mean that if you take lower quantity, it's not the end of the world, oh, it's going to be useless. That's not what happens. You'll get some benefit, because you don't want to take something in so much quantity that your diabetes is helped, but you end up getting other problems. And so I would say stay with 4 grams of fresh ginger or 1 gram of dried ginger powder. And if you don't like the taste of ginger powder or you find it too strong, you can take it in a tablet form. And when you take a tablet, look for about 1 gram of dried powder in it. Now, it doesn't have to be 1 gram, it could be half gram over 2 doses or 1/4 of a gram over 4 different tablets, and you can take them through the day. Now, ginger is a food item, right? It's not a chemical that you manufacture somewhere. And so, different types of ginger, different species, maybe if you take it out at different times in its life cycle, ginger will have slightly different profile of active compounds. The active compounds in ginger which help in diabetes and these other things are called gingerols. Let's not go down the technical path in that, but you want about 2.5% of the dried ginger powder weight in gingerols. Okay, now sometimes it's 2%, sometimes it's 3%, and so the industry standard is to have them standardized to 2.5% gingerol. If that's the case, you take 1 gram of dried powder. If it is 5% gingerol, more concentrated kind of powder, then you take only 500 milligrams, because you want gingerol in certain quantity. You don't care how much powder you take, because the rest of the powder is not so useful. And now obviously I understand this is going to get very technical, and for that I have a separate video on this particular channel. You just search for it. It's called How to Consume Ginger, and there I explain all these technical things and all that if you're interested in that. Now this is a lot of information I have given, and I know it's not so easy to remember all of it. So what I've done is I've already written a detailed article on my website. It has links to various research papers published in last few years. And keep in mind that you should not stop your diabetes treatment and switch to ginger, thinking that, oh, it's natural. Continue with your diabetic treatment, talk to your doctor and see if you can add either ginger or ginger tablet or ginger powder in your diabetes regimen. And if it's okay with your doctor, then go ahead, because ginger will lower your blood glucose, and you don't want to run a risk of very low blood glucose without your doctor knowing about it, right? And so don't just jump in it blindly. At the same time, give about 3 months to see results. This is not some chemical that will give you result on the first day. And you don't have to take this much ginger if you are taking so many other nutrients. It turns out that there are many other good nutrients that also help in diabetes. Nutrients such as cinnamon or gymnema. I have videos on this which you can check at the end of this particular video. They also help. So if you take a blend of all these nutrients together, then you don't need that much of ginger. You can have a little bit of cinnamon, a little bit of ginger, a little bit of gymnema, maybe some Garcinia cambogia, all sorts of things. You can take them together and they will help you get your blood sugar in control. I hope this information was useful to you, and these are the videos that I talked about that could be of interest to you. Thank you very much and stay safe.